So I'm gonna go ahead and get started. If anyone else joins, everything that is going to be said here and presented on is going to be recorded. So if anyone joins late, they can always go back and view the recording if they missed anything particular. Real quick before we get started, if you guys are familiar with the chat function on the bottom of the Zoom call, if anybody has any questions, I don't have a panelist with me today, so I'll be answering all the questions. And the presentation is going to be mostly demonstration, so I'll be able to answer it as these questions pop up. But if anyone does have a question, make sure to open up the chat box. And if you want to share your question, you can go over and click all panelists and attendees so that everybody can see the question. Or if the question is a little bit personal and you just want me to answer it later on, then you can just hit all panelists instead, and then nobody else will be able to see it. All right, cool. And yes, there is a question already. The presentation won't be posted to YouTube. It should be available either through email or on our website. If you go to our website, reactphysicaltherapy.com, it should be there under events and then under webinars, I believe. All right, cool. I'll go ahead and get started with the presentation. All right, so for those of you who don't know me, my name is Garrick Lim. I'm a physical therapist with React Physical Therapy. I'm coming up on about 3 years with React and out of school. I mainly work out of the West Loop location. And yeah, today's presentation will be on how to improve the mobility of your hips. This is a very passionate topic of mine, as I personally have been dealing with a lot of hip pain and hip immobility my whole life. And just a brief history on me. I've been doing a lot of sports, martial arts, track and field, wrestling for the majority of my life. And growing up and playing those sports, I always thought that having really tight hips and pain in my hips was kind of normal until I went to school for physical therapy and started learning a little bit about some of the structures and the muscles of the hip. And then what really helped me fix my pain and immobility was doing these exercises that I have prepared for you guys today. And that's really helped me stay pain-free and flexible in anything that I really wanted to do since then. So I hope it can be helpful for you guys if you guys are dealing with any kind of tightness or discomfort or pain in the hip. Yeah, if you guys have any questions, feel free to ask along the way. All right, so before we get into the demonstrations on the exercises, I want to talk a little bit about what actually causes tight hips. There's a lot of different causes. I've gone and listed some of the main reasons that we usually see in clinic. The number one reason for tight hips, as a lot of you may know or may be experiencing currently, is prolonged sitting. And the reason because of that is our hips aren't meant to be in that flex position that is required for sitting for a long period of time. And what happens is if you are in that static position for a long period of time, the muscles in front of the hip flexors, will tend to get really short and tight. And then when you go to stand up from that position, those muscles, because they were in that position for so long, they're used to staying in there, and they can cause some kind of imbalance or tightness in the front of the hips. Another main reason for prolonged sitting, or another main reason for tight hips, aside from prolonged sitting, is prolonged standing. So a lot of people also think that standing is actually good for your body, which it is. But like most things, you want to do it in moderation, and you don't want to be standing for too long. The reason for that is our bodies are really only made to stand for maybe like 2 to 3 hours at a time at most. Once you start standing for longer than that, the muscles that are required to keep you in that upright position start to fatigue. And what happens is your pelvis and your lower back will start to sink a little bit deeper into the hip or rotate forward onto the hips. Because of that, for the same reason of sitting, the muscles in front of the hips will become really tight, and it can cause that imbalance and tightness or tension and lead to really tight hips. Another reason that can lead to tight hips is while you're standing, leaning over onto one hip or leaning forward or backwards onto both hips. Sleeping or laying on one side for the duration of a night or for an extended period of time can also lead to pretty tight hips, as well as structural deformities and past injuries. In regards to structural deformities, if you do have some kind of abnormality in the shape of either the pelvis or the ball that's part of that ball and socket joint of the hip, there's not a lot of things that we can do externally to help fix that. However, I will say that the majority of people don't really have uniform sockets or balls, and they are still able to perform at 100% function without that much pain, as long as they can stay consistent with these exercises and are able to self-manage their symptoms. But if it is to the extent that it's causing you immobility and pain, then unfortunately surgical procedures would be the only permanent fix for that one. And again, any past injuries, whether it's muscle strains, fractures, or any kind of tears of some of the soft tissue structures around the hip, can also lead to tightness in either the soft tissue or the muscles surrounding it. At this point, I did want to say a disclaimer really quick, especially with these last two reasons. If you are currently experiencing any persistent or constant pain in your hip, the exercises that I have prepared for you guys, it's not meant to solve or fix any of those pains that you may be having. And if you are having pain, I would highly recommend that you seek any kind of medical consultation or advice prior to performing these exercises. Yeah, without further ado, we'll get started. So before going into the exercises, I always like to do a quick anatomy lesson on the part of the body that we're working on, just so people understand exactly what's going on with the muscles and the structure of the joint itself. So like I said before, the hip is a ball and socket joint. You have the socket that's made up of the different bones of the pelvis over here, and then the ball is part of the upper thigh bone or the femur. Because it is a ball and socket joint, it is a multi-axial joint, meaning that it can move in all different directions. And it is actually one of the most mobile joints in your body, second to only your shoulder, which is the other ball and socket joint in your body. So that being said, you have a lot of muscles and soft tissues that surround that joint in order to keep it stabilized, meaning that there are a lot of different areas that can cause tightness or immobility. So looking into the different directions that the hip is able to move, if you look at the image up at the top, we have flexion, which is essentially bringing your leg up in front of you. Extension is the opposite of flexion, so bringing the leg behind you. Abduction or abduction is bringing the leg out to the side. Adduction is the opposite of that, so bringing the leg closer towards the midline or center of your body. And then we have external and internal rotation. External rotation is turning the toes out away from the midline, and then internal is turning the toes inward towards the midline of your body. And as you may have guessed, we have a bunch of different muscle groups that are responsible for creating each of those movements. And a lot of times the same muscle takes on multiple roles and can actually create multiple different movements in the body. All right. So finally getting into the interactive portion of our presentation. Prior to any of the exercises that I'm going to demonstrate, I'm going to go over a couple of tests that you all can do at home to determine whether or not you have either tight muscles in the hip and whether or not the exercises that follow will be beneficial for you. So the first test that we're going to go over is testing whether or not the hip flexors are tight. So these are the muscles that generally become tight if you are sitting for an extended period of time. So to do this, I'll go over the slide really quick, and then I'll exit out of the screen share mode so that you guys can see me do it on the floor over here. So the first thing you're going to do is you're going to lay on your back. This is a modified version of what we do in the clinic, which would be pictured up here. But a lot of people don't have this nice clinical table at their home, so you can modify it a little bit and do it from the floor. So you're going to lay on the floor with one leg straight and the other leg bent. The leg that is straight is going to be the one that you're testing. With the bent leg, you're going to take your hands and pull the knee all the way up to your chest as far as it can go. As you do that, if you start to notice that the straight leg starts to come up from the floor, or the knee and that leg starts to bend as you bring the opposite leg towards your chest, then that's a pretty good indicator that those hip flexors in front of that hip are a little tight. On the contrary, if you start to bring that leg up towards your chest and you start to notice a little bit of pinching pain in front of the hip, that's also an indicator that the hip flexors on that side of the hip may be tight, in which case you would just switch it, make that leg straight, and then bend the opposite leg to see if that leg will raise up. All right, so I'm gonna exit out of the screen share mode so you guys can all see me. And then there was another question that popped up during the beginning of the presentation, and it was regarding any kind of surgeries to fix hip issues. Unfortunately, I'm not going to be going over any of the surgical procedures today. This presentation is mainly meant to be a general overview of some of the exercises that you can do to help with any tightness or discomfort or immobilities in the hip. Okay. So over here, going over that test again, what you would do is lay all the way flat on the floor. And then if I'm testing the hip flexors on the front of my right hip, I'm gonna take my left knee up and try to bring it as far as I can towards my chest. And you guys can all see already that my bottom part of the leg and my knee starts to bend as I do that. So that's a pretty good indicator that my hips flexor muscles in front of my right hip are a little tight, and I might need to do some of the exercises for that. If you were to switch and do it on the opposite side, same thing. As I start to bring my knees towards my chest, you all can see that my leg starts to raise up from the floor. So again, my hip flexors on the left side are also probably a little tight. All right, going back to the screen share mode. Good, so that's a really easy test that you all can do at home to determine whether or not you have any kind of tightness in front of the hips. And if you do that test and you determine that you do have tightness in front of the hips, one exercise that I would recommend you start off with is something called a hip flexor release. The purpose of this is to try to loosen up any of the restrictions that are located within the soft tissue surrounding the muscle or in the muscle itself. And for those of you that were previous patients or current patients with us at React, you guys are probably going to be very familiar with this exercise as we tend to go to it a lot. All right, I'm going to exit the screen share mode and demonstrate this exercise for you all really quick. All right, so for the release, what I really like to use for this is a lacrosse ball and a foam roller. And how you want to find your hip flexor is if you find your belly button, depending on which side you're going to. Let's say I'm going to my right side. I'm going to find my belly button over here. Then I'm going to find a little bony bump on my pelvis in front of my hip over here. And that hip flexor muscle that we were talking about sits kind of in between those two landmarks. So I'm going to take the ball, place it over here. And then what I like to do is take the ball and stack it on top of a foam roller like this, just because the hip flexors sit pretty deep inside. And then I'm going to relax all my abdominal muscles so that it sinks really deep. And then you know that you're on the hip flexor once you feel that sense of tightness inside your stomach. And some people, if it's really tight, they may even feel it kind of going down into their groin a little bit. All right. So once you hook on that, you're going to bend that same leg and start rocking it side to side. So you're taking that muscle to an active motion and allowing the fibers to loosen up. And then for this, we're going to perform it for about 30 seconds to 45 seconds, or until you start to feel that tightness kind of loosen up, and then the range of motion becomes a lot smoother and easier on that leg. And that is how you do a hip flexor release. Then once you do that, the next muscle that you're going to want to go to is going to be the quadricep muscle, or that big giant muscle in front of the thigh. Just because the quadricep does also act as a hip flexor because of where it attaches to your pelvis. So if those hip flexor muscles inside your stomach are tight, chances are the quadriceps are also really tight as well. All right, so to do this one, you're gonna start off in the same positioning. And we had another question regarding a lacrosse ball against the ground. You can use the lacrosse ball without the foam roller. The only issue that I found with that is the lacrosse ball doesn't really give you that much height needed to really sink into the soft tissue to get the flexors, which is why I like to either stack it on top of like a yoga block or a foam roller, just so you have a little bit more distance to travel once you do sink onto it. Yep, that's a good question. All right, cool. So going on to the quadricep release. For this one, you're not going to use the ball for it just because the quad is a broader muscle over here. You're going to start a little bit closer towards the pelvis. Same idea, you're going to stay on the foam roller with whichever side you want to release, and then kind of roll around and find a nice tender spot. Once you find that spot, you're going to start kicking the leg up and down. So remember with the hip flexor release before, what we were doing was going side to side. For this one, you're going to be kicking the leg at the knee up and down like this. And for these releases, you always want to have some kind of active movement with it to allow those muscle fibers to move in the way that they're supposed to as you're loosening them up. So here, you're going to stay on one spot for 30 to 45 seconds. And then once that becomes easier, you're going to move down, find another tender spot, kick back and forth for 30 to 45 seconds. And then you might move down again since the quad is a pretty big muscle and kick for 30 to 45 seconds or until that motion becomes loose. All right. All right, so that was the quadricep release. All right, so then once you efficiently loosen up the hip flexor muscles with the active releases, what you want to do next to kind of reinforce that change, what you want to do next to reinforce the change in that muscle tension is to stretch it out. And stretching is essentially taking that muscle past its normal range, so you're creating a length, more length in the muscle. The best hip flexor stretch that I really like to do is this one that I have pictured down here. And I'm gonna go ahead and demonstrate it for all of you guys. So for this, let's say I want to stretch out my right hip. What I'm gonna do is have that knee on the ground. I'm gonna take my left foot, bring it up in front over here. And then what I wanna make sure is that my knee doesn't travel past my toes. So if you bring your foot up and you're having trouble feeling that hip, then just bring your foot out a little bit more, just so that that knee stays stable and over the ankles and the heel of the foot. So right here, I can already feel a stretch in the front of my hips like this. A lot of people, what they tend to do in this position is to get more of a stretch, they'll start to arch their back like so. I tend to recommend not doing that just because it can put a lot of strain and tension on the muscles and the joints in the back of the spine. Instead, what I recommend doing is once you get to that nice stable position here, you can take that same arm, reach it up over your head, and then lean over to the opposite side. So you're still getting that extra stretch in the hip flexors while keeping the lower back in a neutral alignment over here. And then for this one, you want to hold it for at least 30 seconds to 1 minute. And repeat it 2 to 3 times for a total of 2 to 3 minutes. Cool. And if you have any tightness or discomfort on the opposite side with the hip flexors, you would just repeat it with the opposite leg down. All right. So those are all the exercises for the hip flexor. What we're gonna look into next are the external and internal rotators of the hip. So a nice test that you can do at home to see if you have any kind of tightness in the rotators of your hip is if you're standing up you would close your eyes, and then you would take a couple of steps in place to kind of help reset all the muscles around the hips into back into what I would call like their normal resting position. Then after a couple of steps, you would allow your legs to relax, kind of position your legs to what feels normal, and then you would open your eyes and then take a look down to see where the alignment of your feet and your toes are pointed. If you notice that one or both of your feet or toes is pointed more outward to the side, that may be an indicator that you have tight external rotators in the hip. Or opposite to that, if you notice that one or both of your feet kind of come inward and you have an in-toeing stance like this over here, that may be an indicator that the internal rotators in your hip are a little bit tight. Another test that you can do that I don't have listed here is if you're just standing straight up, put your heels together and either try to rotate all your toes out to the side and see how far you can get. I believe the normal range for external rotation is anywhere between like 45 degrees and 60 degrees. And then to test the internal rotators, you would just stand feet shoulder width apart and try to bring your toes in together as far as you can. The normal range for internal rotation is a little bit less. I believe it's 35 degrees to 45 degrees. So if you notice any kind of difficulty on one side or both sides with trying to rotate your toes all the way out versus rotating them all the way in, that may also be a good indicator that you have tight rotators in the hip. So once you do that test and you determine that you have some kind of tightness or restriction in the rotator muscles, then you would go ahead and do this hip rotator release, which I'm going to demonstrate for you all right now. All right. So the rotators of the hip sit here in the back of the hip joint. So the first rotator muscle is going to be that giant muscle, the glutes that sit in the back of the hip. To do that, we're just going to hop on the lacrosse ball for this one. So if I have determined that the rotators on my right hip are really tight and restricting me in any kind of motion, I'll take the lacrosse ball, find a nice tender spot over here on my glute muscle, kind of put the majority of my body weight onto the ball until I find a tender spot. And then the active motion that we're going to be doing is kind of like a butterfly motion with the bent knee on the same side. Same idea for the hip flexors. You want to stay on it for about 30 seconds to 45 seconds. And after you feel that motion kind of become easier and looser, you would move around a little bit. See if you can find another tender spot. And again, go up and down in that butterfly motion with the leg. Okay. So that is how you release the rotators in the hip joint. All right, and there was another question asking how often should one do these exercises? Ideally, you want to do it every day if you can, or at least every time before you go to do something dynamic or involving any kind of physical activity. Especially if you are experiencing a lot of tightness or discomfort in your hips, the more you do these exercises, the better it's going to get. You can never overdo these exercises. It's probably a better way to put it. All right, so that was the external rotator release. All right. And then after that, similar to the hip flexors, once you release that muscle, you want to reinforce it by lengthening the fibers of the muscle. And there are a couple of stretches that I really like to help with that. So the first one is going to be this figure 4 stretch over here on the bottom left. That is good to help stretch your hips into external rotation. The one over here is really good for stretching your hips into internal rotation. So I'm going to go ahead and exit out of the shear view so I can demonstrate that for all of you guys. Okay, so the first stretch is going to be that figure 4 stretch. So if I had determined that I had some kind of tightness in my rotators on the right side, I would just take that ankle, place it on top of my knee on the opposite leg, and then what I'm going to do is take my hand, reach between and behind that leg and kind of pull it up towards my chest. What I can also do if I want to feel more of a stretch is take that same hand and kind of apply a pressure on that same knee, forcing it more into external rotation. And you should feel that stretch all the way through the back of your hip over here. And then same thing for the hip flexor stretch. You want to hold that for 30 seconds to a minute and repeat 2 to 3 times for a total of 2 to 3 minutes. All right, the next stretch that you might want to do if you determine that your rotators are really tight is the stretch into internal rotation. So to do this, you're going to start off with the opposite setup of the exercise before. So if I was stretching my right hip, I'm going to take my left foot, put it on top of my right knee, and then kind of let my hips drop down to the side like this, so that you're in this position over here. And then apply a little bit of pressure with the opposite foot on top of the knee, so it's pushing more into internal rotation, like this here. And then hold it for 30 seconds to a minute and repeat 2 to 3 times. Cool. Yep. So we had a couple of other questions that were a little bit more personal to the person asking it. If whoever asked that question, if you want to hang around to the end, I'd be happy to go a little bit deeper into some of the questions that you had regarding those hips. All right. Cool. So those are the stretches for the external rotators. We're going to go back to the presentation. And then I believe I had one other exercise or test. Yep. So the last test that you guys can all do at home to see if there's any kind of tightness or immobility in the hips is a test for the hamstrings. The hamstrings are those big muscles that kind of run along the back of your upper thigh into your hip. And a lot of times if those muscles are tight, it can create a little bit more pulling in the back of the hip joint than you may want and cause a little bit of tightness or immobility there. So a good test that you can do at home to test whether or not the hamstrings are tight is laying on your back. You're gonna have whichever leg you're not testing straight on the floor. The other leg that is being tested, you're gonna bring the hips up to 90 degrees from the horizontal, keeping the knee bent. And then once you have that upper thigh at 90 degrees from the floor, you're going to try to straighten up the lower leg and see if you can get it straight to 90 degrees from the floor. Normal range for the hamstring in this position is anywhere between 70 degrees and 90 degrees. But the majority of the time, what we're looking for is that you are actually able to reach the full 90 degrees. If you can't and you're below that 70 degree to 90 degree range, then chances are those hamstring muscles in the back of your thigh are pretty tight. All right, so then once you determine that, as most of you probably guessed, you would want to go in and release the hamstring muscle. So I'm going to hop out of the share view really quick. All right. And to release the hamstring muscle, what you want to do, it's really difficult to release it on the floor just because you don't have as much room to move the leg. So if you have any kind of a folding chair or chair with a harder surface, like this one over here, what you would do is you would take the lacrosse ball, the hamstring muscle runs all the way across the bottom of the thigh. So you're gonna take the lacrosse ball and kind of rest the upper leg on top of it. And it's similar to how we release the quad, you're going to kick at the knee up and down to take that hamstring through its normal range of motion over here. And the same thing, hang out there for about 30 to 45 seconds. once you feel that tension kind of loosen up, you're gonna move the ball a little bit closer towards the knee, find another tight spot, hang out there for about 30 to 45 seconds, and repeat that process until you hit the majority of that hamstring muscle. Okay. All right, and then after that, you're going to want to go in and stretch that hamstring. So the number one stretch that I really like to do for the hamstring is this one pictured down below. The reason being is that it really keeps your pelvis and your spine in a neutral alignment, as opposed to other stretches that you guys may be familiar with, especially the one where you're sitting on the floor with one leg straight, and you're trying to stretch your hamstring muscle like this. That puts a lot of unnecessary tension and strain on the lower back. And especially if you are someone who deals with a lot of lower back discomfort, that stretch or exercise may be more harmful than good for what you're doing. So I really like having that neutral spine and pelvis. So what I like to do is lay all the way flat. And then for this, the only thing that you're gonna need is a belt or a towel. And you're gonna hook the belt around your foot over here, lay back, and you're gonna pull on the belt or the strap back until you feel that stretch specifically in the hamstring muscle over here. And then same as the other stretches before, you wanna hold that for about 30 seconds to a minute and repeat it 2 to 3 times. And to stretch the opposite leg, we would just keep the right leg straight, wrap the belt around the left leg, and then pull back so you feel that stretch in the hamstring over here. All right. Right. And I believe that is it for all the exercises. Yep. So thank you all for joining in and watching me do those releases and stretches for you. It was a lot of fun. If anybody wants to stick around, I'll hang around for maybe 5 to 10 minutes and answer any specific questions that you guys all might have regarding exercises, tightness in the hips, or immobility in the hips in general. Okay. Also, as a quick reminder, if you joined in late, the recording of this presentation and the PowerPoint slides, I believe, should be on our website, or they should be emailed to you relatively soon after the presentation. So if you did want to go back and refer to some of the pictures or the videos, you can always do that. All right, cool. I'll hang around if anybody has any questions. Going back to one of the questions before. Yep. So regarding the question about having hip replacements on both sides and being able to play the drums. So what you want to be able to do is really have the mobility sitting for that extended period of time. I'm not too experienced with how low the stool is for drums, but if you can somehow position the stool where the hips are above the level of the knees, just so that you're not constantly in that overflex position at the hips, it should allow you to kick and play the drums for an extended period of time without too much discomfort. But after you do play the drums for a long or extended period of time, just be aware that those hip flexors are going to become really tight because you are sitting, again, like we discussed before. So either doing the releases for the hip flexors or doing the stretch for the hip flexor will really help. All right. Yep. So the next question is regarding strengthening exercises. So that's actually a very good question. The person is asking, once you do the releases and the stretches and gain more mobility in the hips, what strengthening exercises can you do to kind of help reinforce that newly gained mobility? Um, that one can, because there's so many exercises and so many muscles that you would want to strengthen depending on which muscles were tight, that one can be a completely different webinar series in itself. But really quick, I'll just go over the general concepts. There are more tests that you can do to determine whether or not a muscle is tight because of overuse or because of weakness. And if you do that test and determine that the muscle is weak, then you would want to specifically strengthen that muscle. On the contrary, if you determine that that muscle isn't weak, then chances are you probably want to strengthen the muscle that is opposite to it. That would be, let's say, the hip flexors. If you do a quick hip flexor muscle test, which would simply be testing it against any kind of resistance. So let's say I'm testing my right hip, I would bring my leg up like this and try to press down on my leg while trying to activate my hip flexors to resist that motion. And if I determine that those hip flexor muscles are pretty strong, but I'm still getting some kind of tightness in there, even after doing the exercises, the releases and the stretches, then I would go in and try to strengthen my glutes. If anybody has any specific questions on how to strengthen specific muscles, on our YouTube page and I believe on our website, we have a couple of videos that kind of go into how to strengthen specific muscle groups that you all can look into. That's kind of the general idea about that. And there was another question asking about upcoming presentations. Personally, I don't have any presentations planned in the future, but I do know some of our other therapists at our other locations will have upcoming presentations, and I'm sure some of them will be related to back pain if you are interested in that one specifically. Yeah. We've also been doing these webinar series for a good amount of time now, and I'm pretty sure there are a couple of presentations regarding back pain for different specific causes. If you want to go to our website and take a look at all of the past webinars that we performed, you may be able to find one already that you're looking for. Yep. So all 6 of our Chicagoland locations are open. We're open 6 days a week for most hours during the day. I believe it's West Loop specifically is open from 6:30 a.m. until 8 p.m. And we do have a bunch of lacrosse balls here for sale if you are in the market for new lacrosse balls. If anybody has any pain or discomfort in their hips and they're unsure of whether or not these exercises will be good, kind of like what we talked about earlier, our 6 Chicagoland locations do offer free screens, free injury screens. They're about 10 to 15 minutes long, and we do a full examination on anything that's causing you any kind of pain or discomfort to see whether or not physical therapy is the right move for you, or if maybe you just need a couple of good exercises to do consistently at home that will help relieve your pain. If you're interested in scheduling one of those free consultations, you can either do it by calling the clinics or scheduling one on our website. All right, cool. Well, if nobody has any more questions, I'm gonna go ahead and end the Zoom call. And if any questions do pop up later, I believe at the end of the presentation, I listed my email on there. If you guys think of any other questions regarding tight hips or mobility exercises for the hips, feel free to send me an email and I'll try to respond to you within 24 hours if I can. All right, cool. Thanks, everyone. and see you later.